Did you know that the right dietary supplements can keep not only your body but also your teeth healthy for a lifetime? Most people nowadays do pay attention to getting enough vitamins and minerals for their overall health, but they often overlook their crucial role in maintaining healthy teeth in the long term. Welcome to a new video. I'm Dr. Reinhard Dittmann, and every day in my practice I see just how important proper nutrition is for your dental health. And today I want to talk to you about the most important micronutrients that can keep your teeth healthy for a lifetime. In the next few minutes, you'll learn which 5 nutrients are essential for your dental health, and this information can help you reduce gum inflammation, prevent tooth loss, and preserve your teeth well into old age. And the best part is, these nutrients not only support your dental health but your entire body as well. I haven't just been thinking about teeth and dental preservation for 25 years, but I'm also actively involved in nutrition, dietary supplements, and of course I'm physically active as well. Yes, I'm a multiple Ironman finisher, and of course you need to have good nutrition for that, otherwise you simply can't manage such long distances. And that's why everything I'm telling you today is not only based on scientific studies, but also on my own insights and practical experiences, both with myself and of course with my patients, whom I advise daily, I would say, especially regarding these topics. And naturally, I also try to raise their awareness in this area. Yes, the difference is this: treating the teeth, that's something the dentist can do, but I can't directly influence your lifestyle. But of course, I can give you some guidance on how you can support your overall health and naturally your dental health as well. And people really underestimate, I would say, just how much certain micronutrients can actually influence their dental health. And stay tuned, because later I'll explain why targeted nutritional supplements can sometimes be even more important for your teeth than for your overall health, and how you can use them to effectively prevent tooth loss as you age. But first, let's address a fundamental misunderstanding and clear it up. Many people immediately think of the hard tooth substance when it comes to dental health and believe, for example, that calcium might be the limiting factor, since calcium is somehow present in tooth enamel. And so they think that if they have too little calcium in their body, then there is also too little calcium in their teeth, and if they simply take in more calcium, that's great, because then more of it will reach the teeth. But the truth is, whether calcium dissolves out of the tooth enamel or not has little to do with your diet and much more to do with the presence of dental plaque and carbohydrates. Yes, because calcium is dissolved out of the enamel by acid, and whether this acid is present or not naturally depends on your oral hygiene and on how much or how often you eat carbohydrates. Yes, that's simply the crucial point. But the real key to long-term tooth preservation isn't calcium, it's your metabolism, because it determines how severe inflammations are that are caused by biofilms, that is, by bacteria, in dental plaque. And from around the age of 40, periodontitis, that is, inflammation in the supporting structures of the teeth, becomes the main cause of tooth loss, not cavities, as many might assume. And so that your body doesn't break down the jawbone through severe inflammatory reactions and you don't end up losing your teeth, you need a metabolism and an immune system that are capable of fighting bacteria without producing massive inflammation. Yes, and you have to assume that there will always be bacteria present somewhere. So no one is really able to eliminate 100% of all bacteria in the mouth, and that's not even what we want. We actually want to have an oral flora, it just needs to be healthy. But you simply won't be able to completely eliminate bacteria, and that's why you need a healthy metabolism, and this is where our 5 crucial micronutrients come into play. So, and before I introduce you to the 5 most important nutrients, have you ever thought about which nutrients might influence your dental health? Feel free to write your guesses in the comments. I'm curious to see if you might already be on the right track. Alright, now let's get to the 5 most important nutrients for your dental health. Point number 1, omega-3 fatty acids. This is probably the most important nutrient. Not because omega-3 itself is so powerful, but because the deficiency in Germany is simply very pronounced. Yes, and that's why even small doses can bring about a significant improvement, because these omega-3 fatty acids have an anti-inflammatory effect and regulate your body's immune response. With gum inflammation, our immune system often overreacts to the bacteria in the mouth, and that's where omega-3 simply helps to dampen this reaction and steer it in a healthy direction. So now the question is, which type of omega-3 do you actually need? And this is where the devil is really in the details, because many people think that if they eat flax seeds or chia seeds, they're getting omega-3 and believe that with that, they can fight not only gum inflammation, but also other inflammations in the body. But unfortunately, that doesn't work, because you need the marine omega-3 fatty acids. These are, so to speak, EPA and DHA. And you won't find those in flax seeds or chia seeds, for example. For that, you basically need, I would say, to rely on sea fish. And of these 2 fatty acids, it is especially EPA, that is eicosapentaenoic acid, that truly has an anti-inflammatory effect. And there are now studies with slightly modified forms of this EPA, which have also shown that, for example, the risk of heart attack can even drop dramatically if you have a good supply of it. And to give you another idea of how important omega-3 is, imagine someone traveling in the desert without any water, on the verge of dying of thirst. So this person may have many needs. Yes, of course they're thirsty, they need water, but maybe they're also hungry, maybe they're feeling hot, or they have some other problem. But the question now is, what is the one thing, the one substance you need to give this person so that they can feel much better very quickly, so to speak? And in this case, that would be water. The problem is that in your own body, you simply can't see what you're most urgently lacking, or why you're not feeling well, or why your gums aren't healthy. And very often it's omega-3 that is so dramatically lacking that even with small doses of omega-3, you can actually achieve really significant effects. And if you were to actually use the right dosage, imagine, instead of just dripping water into the mouth of someone dying of thirst in the desert with a pipette, drop by drop, you actually give them a whole bottle of water to drink. Then you can imagine how quickly they would breathe a sigh of relief, how quickly they would start to feel better. And we see the same thing in people who have a severe omega-3 deficiency. When they finally take the right kind of omega-3 in the correct dosage, you can see how dramatically and quickly their gum health improves. Of course, if you have even more nutrient deficiencies, if you're also missing the other 4 that I'm about to introduce, then omega-3 alone naturally won't have as much impact. But just knowing that and actually getting tested can really help you. The question now, of course, is where do you get it from? I'd be happy to give you a few tips at the end of the video on where you can get the right omega-3. Because as I said, if you just take the wrong kind or not in the right dosage, you won't feel the effect as strongly. So let's move on to the second one. That is vitamin D. I'm sure you've all heard of it before. Yes, vitamin D plays an extremely important role in metabolism, and it has been proven to lead to better tooth retention. There are now scientific studies that clearly demonstrate this. People with higher vitamin D levels have a lower risk of losing their teeth. Why exactly this is the case? Well, there are some theories about whether it's because bone metabolism is improved, so the teeth don't become loose as quickly, even if bone loss might be the same, and whether dentists are more likely to extract these loose teeth in people with low vitamin D, or how exactly all of this is connected. But what we do see is simply more vitamin D means more teeth in the mouth. Yes, and that's why it's very important that you are adequately supplied with vitamin D. And now, don't think that just a little, let's say, going out in the sun is enough. Yes, the German Nutrition Society says 10 minutes a day with your hands and face in the sun is, of course, complete nonsense. Sorry to say, but what's being spread there is scientifically completely untenable. Yes, because first of all, in Germany, we have a UV index that doesn't produce any UV at all from October to March. So you actually need, let's say, a sun angle of at least 45 degrees. And you can tell by the fact that the shadow your body casts in the sunshine is shorter than, let's say, your body length. Then you have more than 45 degrees, and only then do you actually start producing vitamin D in your skin. And that means even in spring or autumn, it only works around midday. Yes, so not in the morning or evening either. And if you measure this in Germany, the average vitamin D level is somewhere between 16 and 24 nanograms per milliliter, and the lower limit for health, as science actually defines it, is 40 nanograms per milliliter. Yes, that means the German average is about half of what, let's say, the minimum amount you should have. This means that without specifically supplementing it, most people have a dramatic vitamin D deficiency. So now the question is, how can you raise your vitamin D levels? There are many sources for that. If you'd like, I'd be happy to make a separate video about it. Feel free to write in the comments where you get your vitamin D from. There are quite a few interesting sources where you can actually calculate it yourself. And just a little spoiler here, 1,000 units per day probably won't be enough. So let's move on to the third one. That is magnesium. Yes, you've probably heard of magnesium before, especially often in connection with sports or muscle cramps or something like that. But magnesium is actually involved in over 600 metabolic processes, and practically nothing in our body works without it. And one very important property of magnesium, for example, is the regulation of the muscles in our blood vessels. Yes, only if blood vessels, for example, are able to dilate. Yes, that means if the muscles in the vessel walls are able to relax, then good blood circulation and therefore effective immune defense is possible. And especially in the gums, you need good blood circulation. Yes, and you might know from athletes that when they have a magnesium deficiency, they get muscle cramps. That means the muscles contract and can't relax anymore. And the same thing can happen in your blood vessels. Yes, so if the muscles in your blood vessels can't relax, then the vessels are simply constricted and just let too little blood through. And without good circulation, you simply don't have good immune defense. So now the question is, where is magnesium found? Yes, magnesium is lost very quickly due to stress, exercise, and also, for example, through alcohol. And it's also important that you see a doctor who can measure it for you, once in the serum, once in the whole blood, just to see what your magnesium levels are like. And unfortunately, I might have to make a separate video about how to interpret these values. Yes, because the problem is, If you go to a regular general practitioner, they'll measure your magnesium and maybe say, I don't know, you have a value of 0.71 or something. Then they'll say, yes, wonderful, you're within the reference range. But what is the reference range? The reference range is simply the average of the people around you. So that means these aren't actual target values, but rather current values that your result is being compared to. And the question is, if you look around at your environment, is the average you see really what you want? Or would you perhaps prefer a biological optimum rather than just what you see on average around you? So here too, we might need to point out again that this value should actually be measured and perhaps also interpreted correctly in order to determine which magnesium you should supplement, in what dosage, and at what intervals it might need to be checked again. So magnesium is also an important factor for your immune defense. Mainly because, of course, it enables proper blood circulation in the first place. So number 4 is zinc. Without zinc, your body can't heal any damage at all. That's why zinc is especially needed wherever a lot of repair work is required. And that's actually the case with the gums due to the constant bacterial exposure that you simply have in many areas of the mouth. Yes, nowhere else in the body do you have such a strong bacterial load as in the oral cavity, simply because you have this biofilm on the tooth surfaces. Nowhere else in the body is there, let's say, this kind of interface in an aqueous environment where such a strong biofilm can form, maybe with the exception of tonsil stones or something like that. But otherwise, you just don't have that in the rest of the body. And in the mouth, you simply have a higher bacterial load. So that's why you also need more zinc, because your body has to produce more defense substances to fight off the bacteria there. And you know this when you have a cold. Zinc is also recommended in that case, of course. Why? Because your body needs zinc to build proteins. Yes, that means without zinc, the body can't assemble proteins, that is, amino acids, and therefore can't produce these defense substances. So, zinc is essential for your body to be able to mount a defense, and the benefit, well, it's not just your gums that profit from this, but your whole body. Yes, your immune system will be stronger, your nails will become harder. Yes, so if you have brittle nails, for example, that's a sign of zinc deficiency. So you should have that checked and maybe supplement it, because as I said, your body simply can't build protein without zinc. And I would say protein is actually the main component of the body. Everything in the body that is important is made of protein. Not just the muscles, of course, but also the bones, your immune system, and even hormones. The happiness hormones you might want are often made of protein. Growth hormone, for example, is a protein. These are all things you would naturally like to have, but you can only get them if you not only have the protein available, but also zinc, so that the body can put it all together. Good sources of zinc include oysters, beef, pumpkin seeds, and also lentils. Yes, and what's important is that the body can't store it, so we have to supply it daily. Number 5, this is also extremely important. You've probably been waiting for this one. It's vitamin C. Yes, vitamin C is absolutely crucial for the repair of connective tissue. Yes, so the body can't build connective tissue without the presence of vitamin C. You might know the sailor's disease, scurvy. Yes, the problem there was that eventually the sailors bled to death because essentially their blood vessels disintegrated. And why do blood vessels disintegrate? Because the vessel walls can't be repaired without vitamin C. And long before you actually bleed to death, your teeth start falling out or you develop severely inflamed gums. Yes, that's simply a consequence of vitamin C deficiency. It's often said that gum inflammation is the little sister of scurvy. That's really important to know. Vitamin C is absolutely crucial for the production of collagen. And that's essential for the stability of the gums. And I don't think I need to explain anymore where vitamin C can be found. It might be important to know that, for example, when you cook vegetables, the vitamin C is destroyed. Yes, at around 70 to 80 degrees Celsius. If you heat anything to that temperature, the vitamin C is basically gone. That means if you eat cooked vegetables, you're actually eating dead vegetables. Yes, the minerals end up in the cooking water, and vitamins like vitamin C or folic acid are destroyed. They're simply no longer present. That's why it's important to eat fresh vegetables, ideally ones that haven't been stored for a long time somewhere, but rather, as I would say, harvested relatively recently. Ideally, you pick a fruit straight from the tree or a berry from the bush, and then there's still a relatively high amount of vitamin C in it. Otherwise, of course, you can also supplement it specifically. And here again, it's very important. Vitamin C is used up very quickly in the body. Yes, that means if you, I would say even taking it once a day isn't really enough. It would actually be better to take vitamin C 2, 3, or even 4 times throughout the day in order to maintain an appropriate serum level. Measuring it in the blood isn't that easy either, because it has to be processed relatively quickly. Vitamin C breaks down very fast through oxidation and then can no longer be detected. So I'd just like to share an example from my own practice. A patient in his mid-50s came to us with a very advanced case of periodontitis. And despite good oral hygiene, the condition of his teeth had deteriorated significantly. On top of that, the patient was also a smoker. That wasn't great either, but in some of the front molars, we saw bone loss almost all the way to the tip of the root. And then the problem is, when you decide with such patients that you might have to pull a few teeth, it sets off a domino effect. Most of the other teeth follow suit, and in the end, maybe only the canines are left to work with. And then you either need 6 implants to get something fixed again, to have permanent teeth in the upper jaw, or you definitely need implants just to be able to secure anything at all. And then you might end up with a removable bridge. You can live with that, but of course it's not ideal, and it's obviously better to keep your own teeth. And this patient not only underwent periodontal treatment with us at the practice, but also went to see my wife, had a blood analysis done, quit smoking, changed his diet, started taking nutritional supplements, and of course the 5 I just introduced to you were absolutely crucial in this process. And I have to say, we're still amazed today. It's been almost 10 years now. The teeth are really firm again. They were already loose, but today they're even firmer than they were 10 years ago when he first came to our practice. And I have to say, for me, it's still almost a miracle. But of course, it's not just our achievement, that's clear. It's also thanks to the patient who simply realized that he had to make a choice between his smoking habits, his eating habits, and his teeth. He then chose his teeth, but of course also his overall health, and simply changed his lifestyle. And by doing so, not only preserved his teeth, but certainly, I would say, dramatically improved his general health as well. But it's really amazing to see what a truly dramatic impact these, let's say, nutrients, this lifestyle, and ultimately diet have on gum health. And every time I see the patient, it makes me happy. And when we take x-rays of the teeth, you can always see how stable the jawbone is. Yes, when you consider how quickly it was deteriorating before and how stable it is now, it's really very impressive to see. Yes, so how nature can not only punish us, but also reward us if we behave correctly. But now to the most important question. How do you actually put this knowledge into practice? So first of all, before you take any dietary supplements, it would be advisable to have your current blood levels checked. Yes, of course, your general practitioner can do that, but I would actually recommend a specialist who is familiar with preventive medicine. Yes, so here in Potsdam, I can of course recommend my wife. She's also an internist, but she has her own private practice with a focus on prevention. And I would say that's her daily bread, doing these kinds of blood analyses and then giving advice or, recommending dietary supplements in the right dosage. And of course, she can also monitor how things develop over time. But of course, you'll need to check locally to see who is truly specialized in this area. There are also some alternative practitioners who specialize in this. You can also look into them, as some of them also evaluate blood analyses. It's just important to know that when it comes to medical matters, you need to clearly define the boundaries and perhaps involve a doctor as well. Basically, you could say that any doctor specialized in molecular medicine would be a good place to start. Secondly, the dosage should of course be individually adjusted. General recommendations, like a one-size-fits-all approach, can sometimes do more harm than good. There are, of course, things that you could overdose on. That does happen extremely rarely, and there are virtually no cases of, let's say, major or serious complications from taking vitamin supplements. But still, you should make sure that after supplementing, you stay within the right range. And thirdly, of course, try first. And this is a really important point that is very close to my heart. Don't try to compensate for a completely unhealthy diet just by taking supplements. Yes, that won't work. Instead, first and foremost, try to get all these nutrients through a healthy diet. Yes, I already gave 1 or 2 hints, and supplements should be exactly what their name suggests, a supplement, but not a replacement for a healthy diet. So let's briefly summarize what we've learned so far. So, the 5 most important micronutrients for the teeth are first, omega-3 fatty acids, because they help regulate inflammatory processes. Vitamin D is important for immune modulation and bone health. Then third, magnesium for circulation and the other 600 metabolic processes it is involved in. Zinc for wound healing and immune function. That is, the formation of proteins. And fifth, vitamin C for collagen production and tissue repair. So, these nutrients not only support your dental health, but also your overall health, forming the foundation for a functioning metabolism that can keep inflammation in check. I also promised to tell you my source for omega-3s and to explain exactly what is crucial for gum health in this regard. And that is from Norsen. I can also gladly link it below in the video description. So there are different products available now. Basically, you distinguish between fish oil and vegan algae oil. Yes. So you can imagine fish oil tastes a bit more like fish, so it's not as pleasant. That's why you might say, let's just take the algae oil, that's better then. However, the difference is the ratio between these 2 omega-3 fatty acids, EPA and DHA. Yes, while in fish oil the EPA is, let's say, present in about twice the amount as DHA, so a ratio of 2 to 1, it's the other way around in vegan algae oil. So their EPA to DHA is basically in a ratio of 1 to 2. This means basically you have to take a much higher amount of omega-3 with vegan algae oil if you want to get the same amount of anti-inflammatory EPA. So, and apparently Norson has also recognized that people prefer to use vegan algae oil but still want the anti-inflammatory effect of EPA. And that's why they now have a new product on the market that practically combines both advantages. So on the one hand, it's the vegan algae oil, where no fish have to be killed to produce it, and which also tastes a bit more pleasant. At the same time, they've added EPA to it so that the ratio is reversed again, meaning there's more EPA than DHA in it. And that's basically what I would strongly recommend using. And I would say, even if you compare the market, looking at how high the dosage of omega-3 is in this oil, so the question is, how much oil do you have to take and how much omega-3 do you actually get? In that regard, this product is really leading. I have hardly found any other manufacturer that has so much omega-3 per, let's say, total amount of oil. And with this vegan omega-3 from Norson, you get 40 grams of omega-3 per 100 milliliters. Yes, just imagine, 100 milliliters is roughly equivalent to 90 grams of oil, and out of that, 40 grams are omega-3. So, and the recommended dosage would be 3 to 6 grams per day. And if you break that down, it means you should use up a bottle like that within 1 to 2 weeks. Of course, spread out over individual doses, not all in one day, so that you reach this daily dose of 3 to 6 grams. And then there's always the question, do you take it as a capsule or as an oil? Personally, I take the oil and pour it into a small shot glass and then swallow it, and then drink something afterwards so the taste doesn't linger in my mouth for too long. Of course, you can also take capsules, but if you take 6 grams in the form of capsules, that's about 12 to 18 capsules. That's quite a lot. I can't manage that, which is why I take it as oil. But everyone can decide that for themselves. So there's a link to Norson again in the video description. I think there's a discount code, Dittmann15. With that, you get 15% off your first order if you want to use it. Otherwise, as I said, feel free to do your own research. There are other products on the market, but Norson is the one I've been using myself for many years, and I can really feel that it genuinely makes me feel better, and my overall sensitivity to pain is also lower than it would be if I didn't take it. Yes, with the knowledge you have today, you can now actively contribute to preserving your teeth for a lifetime, and proper intake of omega-3, vitamin D, magnesium, zinc, and vitamin C helps your body control inflammation and repair tissue. And if you combine this with good oral hygiene and regular dental checkups, you are laying the foundation for long-term dental health. And the best part? These nutrients also have a positive effect on your entire body, from heart health to the immune system. As you can see, dental health is a complex topic, and I want to help you understand all the important aspects. That's why I will, of course, make more videos on related topics such as optimal oral hygiene, the connection between nutrition and dental health, as well as modern treatment methods. If you want to learn more, feel free to subscribe to this channel so you won't miss any videos and will always stay up to date. Thank you for watching, and I'm looking forward to the next video. Until then, yours Dr. Reinhard Dittmann,